Hey everyone, take number 33 on this presentation. Welcome to my breathing presentation, the bridge between the conscious and the subconscious. Let's go ahead and dive on in. So first, I want to take you guys through a brief overview. We're going to go into a small introduction of some of the noteworthy experts that I've kind of followed, dive into some of the mechanical components of breathing and respiration, and discuss healthy and unhealthy treatment breathing patterns, highlight assessments, outcomes, treatment protocols that we could use, and just wrap it up with some take-home notes. So don't want to spend a whole lot of time on this just because I'm going to be low on time if I go too far into it. But I do want to note the first person on the top of the list, Dr. Jack Feldman from UCLA. So he's actually been a huge pioneer in just respiratory science. He's the person that found the pre-Botzer complex. The next page is actually going to be talking about him quite a bit. So anyways, these are the list of everyone else that I was following. So I mean, Wim Hof is on here for cyclical hypervention, and we're also going to touch on the polyvagal theory later on in this presentation as well. Okay, so on to mechanics. So mechanics are broken up into components. We have mechanical and chemical components to respiration. So the mechanics of respiration are active and they can also be passive. So what I mean by that is the process of ventilation is an active response where we have to activate all the mechanical structures, nose, mouth, larynx, lungs, alveoli sacs, the diaphragm and intercostal muscles, along with the phrenic nerve, the vagal nerve, the pre-Botzinger complex, and the parafacial nucleus. So kind of going into those two brain centers right now. So the pre-Botzinger complex was found by Dr. Jack Feldman from UCLA. He originally thought that it housed and pretty much controlled the totality of respiration, but later found out that there was a separate structure in the brain that was responsible for active exhalation, which is the parafacial nucleus. And the parafacial nucleus is more responsible for the non-rhythmic patterns of breathing. So this could be in speech or laughing, for instance, whether we're doubling up on inhales or focusing on controlled pauses. So this is where the conscious mechanism or the conscious control of breathing steps in, where we could perform box breathing or even physiological sighs. Okay, so the chemical components to it, it's just important to note that the brain is it requires a lot of oxygen, about 25% of the oxygen that we breathe in. So it's going to be very sensitive to changes in pH level. So if we have too much carbon dioxide, we become hypercapnic, and that will decrease the pH level, becoming more acidic, increasing amygdala excitability. And on the reverse side, if there's too little carbon dioxide, so we're hypocapnic now, it's going to increase the pH, become more alkaline. It's going to increase alertness, increase brain activity, but it's also going to decrease sensory interpretation. There's going to be a production of adrenaline and epinephrine, leading to anxiety and panic, increased muscle tone or tension, sorry, and it could even result in seizures. So, carbon dioxide is a very, very necessary chemical component of respiration, and it's essential for the gas exchange to deliver oxygen to tissues and especially to the brain, because it serves as a binding agent in the process. So without it, oxygen can't be released from the red blood cell. Okay, so continuing on with some of the underlying factors that affect breathing. So the mechanical factors, the different muscles that I've listed, the integrity of them, the spinal alignments, and the musculoskeletal movement, because posture can definitely affect how we breathe. And then the chemical factors, kind of talked to you guys already about the importance of CO2 and what that does when we don't have enough or we have too much. And this also brings in the psychosocial factors that go into breathing, because breathing isn't just a volitional action, it's also something that is sympathetic to stimuli through that parafacial nucleus. and through the ANS, and we're going to talk about the polyvagal theory here soon. But the psychosocial factors are emotion, anxiety, pain, stress, fear that can alter breathing patterns, and this highlights just how your brain operates in order to perceive the various levels of stress and threat, and associates them as a reflex or some kind of higher center control mechanism to respond to perceived threats in our environment. Okay, so continuing on talking about the nervous system. So the autonomic nervous system, component of the peripheral nervous system that regulates involuntary processes like heart rate, blood pressure, breathing, digestion, and so forth. It's broken up into three different divisions: parasympathetic, sympathetic, and enteric, right? So the sympathetic is where we get our flight fight response. Our parasympathetic is where we get to just relax. So it helps us kind of uh, assess our risks and our threats, helps us kind of calm down, so to speak. So that way we know when to socially engage and I guess become just interpret the different stimuli, so it helps us understand our perceived level of threat. The enteric division of the ANS is more geared towards just digestion processes of food. Okay. So, anyways, now that we kind of got that out of the way, I want to touch on polyvagal theory, but I don't want to go too crazy into it because that in itself could get somebody lost for quite a bit of time. But what I do want to highlight is that the polyvagal theory, there's not one definition really for it because there's so many things that the vagal nerve is incorporated into. Uh, in the sense that it's innovated in so many in pretty much all major organs. I mean, the vagus nerve in itself is a component of the parasympathetic nervous system. It's the longest nerve in our body that contributes about 75% of all ANS activity and peripheral nervous system activity. 80% of the vagal fibers are sensory and innervated through all the major nerves. So the polyvagal theory um, not only highlights evolution of our nervous system for adaptive behavioral strategies, but it also serves as a reflective state of what's going on with the nervous system. So the last point I have on here is neuroception, your body's ability or your nervous system's ability to assess risk and control the stimulus. So this is once again highlighting about the evolution of our nervous system. And I'll touch on that into a quick second here, because when we really think about how the nervous system has evolved, when we look at lizards that don't have diaphragms, and we as mammals have diaphragms, and what that does for us, it enhances our oxygen delivery to our brain, which speculates the advancement of brain development due to increased oxygen potentially, and higher thinking patterns. All right, so I'm gonna keep pushing on because I got a lot of content I still got to cover. All right, so real quick, let's just take a quick breath, full pun intended here, right? But really, it's just to kind of come back, kind of collect ourselves, got over a huge brief overview. So before I kind of tie this into how we could use it in rehab, let's just understand a couple of different things. Let's try to understand what we mean by abnormal or normal, functional versus dysfunctional, because what's really normal? I mean, it's understood there's not really a consensus for normal breathing because it's supposed to change with the various stimulus that we see. But anyways, I mean, there are averages. Like the average person breathes about 6 liters of air per minute, so that's about 12 breaths per minute. However, most of the population tends to over breathe. So we're breathing about, on average, about 15 breaths per minute instead of 12. But when you think about box breathing, if you do something 5, 5, and 5, I mean, it takes 20 seconds for a single breath. So in 1 minute, you could breathe about 3 to 4 times. So it's different. It makes you start wondering, what does optimal breathing rates kind of look like? But anyways, so there's a lot of different arguments and debates, like disorder versus disease, subconscious versus conscious, healthy breathing patterns versus unhealthy, nose mouth breathing, and then authentic and unauthentic movement. So we're going to touch on all these real quick before we go over to the next slide. So when we talk about disorders, right, we're more so talking about how the vagus nerve is so intertwined with everything that's going on. So the vagus nerve is integrated into all major organs, right? Um, so when we see the presence of disease, it's fair enough to speculate that there could be a nervous system disorder that's manifesting itself as a disease because the vagus nerve, the pathway or the vagal tone can change, just signaling to the body about a need that needs to be addressed. So it's important just to be mindful of your words when you discuss disease versus disorder, because a disease isn't something that's necessarily treatable, but a disorder is definitely something that can be. But then when we start talking about the subconscious and conscious uh, actions or processes of the breathing of breathing patterns, we kind of start talking about certain things that go like we don't pay attention to, like a natural sigh. It's a natural process that our body just does as an autonomic way to self-regulate pH levels. So there's an interesting study that I found, or that Dr. Feldman discussed about mice. So he found a specific peptide that was released during stress. So this was done in mice. So this peptide is called bombacin. Bombacin's present when there's stress, which increases sighing. So they kind of reverse engineered it so that way they actually inhibited bombacin peptides. And what had happened, well, I mean, unfortunately, all the mice died in this study. So it's theorized that if you take away sighing, that natural ability to self-regulate pH levels, because people won't notice, but they probably sigh about once every 5 minutes. Just completely subconscious, just not even aware of what's going on. So, anyways, once we take away the natural process of sighing, it is fair enough to say that there is a decrease in lung function. So an example of an unhealthy breathing pattern, hyperventilation. It's increased ventilation resulting from stress or anxiety, depletes CO2 levels, and this impairs the hemoglobin in the blood, affecting the gas exchange process. So it's going to reduce oxygen levels in the brain, which, like I said, the brain is a really sensitive organ, so it's going to detect pH levels, changes in pH levels really fast, create a laundry list of cascading signals, like decreased sensory processing, and so forth. So, anyways, moving on. So naturally we are diaphragmatic breathers. And why is that? Because we're mammals and we have diaphragms, and it's probably the reason why we have advanced brain development compared to other animals like lizards. I'm just going to keep using that as an example. However, if the diaphragm is being dysfunctional, then we can see accessory motor pathways kind of trying to compensate for that. And then let's talk about nose versus mouth breathing real quick, because I know this is an interesting conversation that comes up pretty regularly. Is one better than the other? And I could say this much, that it's more efficient to breathe through your nose for a couple different reasons. It warms the air, it moisturizes it, it filters it. And Dr. Feldman had mentioned a couple other interesting nervous system adaptations that come with nose breathing. So when we inhale, the pupils will get larger, reaction time increases as well. We also increase our ability to learn and focus as well. And I believe a lot of that's due to the increase in just brain area activity. Because when we breathe through our nose, we're also going to be utilizing or activating our olfactory system. So there's going to be increased hippocampus activity, and it's going to lead to improved improved forms of stimuli processing. Another study that Dr. Feldman had performed in regards to fear is that he found that in mice that were actually conditioned to breathe at a lower respiration rate, in compared to a control group, they found that there was an actual decreased freeze state in response to a fear stimuli. So I thought that was interesting to share. Also, by nose breathing, there's going to be a release of nitric oxide to vasodilate, improving the gas exchanges into the body. So, anyways, overall, it's more beneficial because it's going to actually increase the time to inhale and exhale, which is going to lead to the natural breathing pauses that we may see. Another thing that's pretty interesting to note as well is that, when we come to single side nasal breathing, I mean, there's limited evidence speculating if it really works or not, but the theory behind it is that it's supposed to activate toward the, toward the side that we're breathing out of. So if I breathe left nostril, left side of my brain, or maybe my right side. Um, all right. Anyways, and so the last bit too, authentic versus unauthentic. This is more talking about movement patterns, because when we think about an authentic movement pattern, we should be able to breathe totally fine. It shouldn't alter our breathing. Versus if it's an unauthentic movement, it may cause shallow breathing, hold the breath, or maybe we're trying to brace as we move through this pattern. So that's unauthentic movement and breathing patterns, where it creates the unnecessary bracing. Another good indicator for people that are kind of predisposed to excessive bracing is going to be that anterior neck muscle because of the accessory that's happening. So we'll kind of discuss that a little bit more here in the next coming slides. So at this point, we've covered quite a bit of the breathing systems, just the respiration, ventilation, so forth, and just how it's a vital function to us. Um, and we see that CO2 isn't just a waste product, and we understand how crucial of a role it plays in um, in gas exchange and just in respiration as well. There's an interesting note that I want to bring up in here is the gas reflex that occurs when we see somebody that's overdosing on opioids or even just facing death. It's such a interesting uh, pathway because it's meant to auto resuscitate our body. So when it fails, I mean, that's when we ultimately we pass away. Um, we've also at this point talked about the evolution of the nervous system, which just another thing just to kind of bring up about how mammals having a diaphragm, if you really think about your face and your eyes, your ears, your mouth, and all those things are pretty much there just to help us process the number of stimuli coming through our brain. But how does this really tie in with your treatment? Is this a missing piece to it, right? So something I want to bring into it real quick here is brain state. So understanding how the vagus nerve tied into the ANS, and uh, it's easy to understand that your brain state can change your breathing pattern. So therefore, in a top-down mechanism, we understand it, but in a bottom-up, we can also utilize breathing, whether they're exercises, different patterns that we want to incorporate, right, to help change brain state. Right. And also just by taking control of it, because breathing, like I said, it's not just volitional. There's an emotive component into it as well. So I mean the pre-Botzinger complex and the parafacial nucleus, kind of really they really display the reciprocal relationship with breathing, and how it could serve as a form of introreceptive meditation for like anxiety treatments. Um, so anyways, moving forward out of brain state and just kind of moving into a little bit more movement. So I wanted to touch back into this as well, because when you talk about movement, breathing dysfunction is a mechanical dysfunction. So it's a stability or motor control dysfunction. And it's an interesting question to think about. Does poor movement pattern cause poor breathing patterns, or do poor breathing patterns create poor movement patterns? So the real goal in treatment should be geared to restoring authentic breathing and movement patterns, because there could be a number of compensations, so like pseudo bracing, whether you're grasping, grimacing, because you're not quite comfortable. So inefficient breathing could take place because you're anxious or you're anticipating pain or something like that. So it's important, if we're going to use something like the SFMA, where we want to use some of these movement patterns to find some of the limitations and extremities, note those changes in breathing, and start working through those, because posture and position can definitely reduce breathing mechanics. So it's common to see that certain positions may cause shallow breathing, cause them to hold their breath, or step into pseudo bracing patterns, which would be found as not normal or unauthentic. So when we're treating to actually restore a movement pattern, it would be geared towards the ability to complete a full cycle breath with unrestricted breathing at end range motion of the movement pattern. All right, so let's talk about some of the breathing disorders that we can see. So the first one, paradoxal breathing. So this is going to be kind of the opposite, where when we breathe or when we exhale, uh, our belly usually it retracts. So paradoxically, it will, when we exhale, it'll extend versus uh, retract, and when we inhale, it'll retract versus extend. Sorry if I lost you guys on that. Um, apical, pickle, apical breathing. Sorry about that. We're just highlighting accessory movement, like more chest breathing or accessory shoulder or sternal movements that occur with abnormal breathing patterns. We could also display asymmetrical breathing patterns, whether they're unilateral, like a case of a pneumothorax. Could also have anterior breathing patterns or anterior lateral breathing patterns, meaning that there's no posterior movement. And also there's hyperventilation. And when we get further into assessments, there's an actual outcome for diagnosing hyperventilation breathing patterns. All right, so on to assessments. A lot of this stuff can definitely be observational, but there's no best recommendation out there currently. So there are two sets of skills that we probably need, just the skills in order to be able to identify, um, breathing rates, postural asymmetries. We could take rib cage measurements, high-low assessments that could be performed either supine or sitting, looking for those accessory movements. Are they a nose breather, mouth breather, and also trigger points. Another test that we could also perform, I recommend using this one before doing any kind of breathing treatment, just to understand the excuse me, the CO2 tolerance test. And this is performed basically by inhaling through the nose, starting the timer, controlled exhale out slowly as possible until the lungs are completely empty. And pretty much based off the time that we get on this, we are either classified as low tolerant, moderate tolerant, or high tolerant. And that just kind of helps us prescribe a specific number to like things like box breathing. Lastly, another assessment that we could perform is a modified manual assessment for respiration. And so if you look at the picture that's on this slide, you guys can see where the clinician's hands are, and they're just going to be uh, by the 11th and 12th rib. And so while our patient's breathing, we're just measuring the perceived displacement and functional movement of the upper and lower rib. All right, next slide. So these outcomes, we're going to measure changes from everything. I mean, we could use the optimal breathing window. That'll be on my next slide. Patients may report energy sensations after treatments. We can retest rib cage measurement, reassess high-low breathing patterns, once again, if we're supine or sitting. We could also re-rate breathing rates and breathing pauses, pain, and also movement. All right, so this is the optimal breathing window. So you can see red above, red below. This bottom piece is inhaling, this bottom piece is exhaling. So this blue area from 3 to 8 is actually our easiest breathing window. So anything above an 8 is really like forced inhaling, and anything below 2 to 0 on this exhale right here, this is also forced or labored exhale. So a lot of the optimal breathing window has you operating between uh, the 3 and 8 mark here. Another outcome that we could also use is the self-evaluation for breathing questionnaire. This is just going to reflect signs and symptoms that are associated with breathing pattern disorders. It's scaled 0 to 3, just in frequency. So you can see questions like, are they easily breathless? Do they notice themselves being shallow in breath, constantly sighing or yawning? Are they noticing that they're more irritated? They can't catch their breath. So if they score anything greater than 11, that indicates a problem with breathing. All right, next. I'm probably going to screw this up when I say this. So it's the Nijmegen questionnaire. So this one I found to be really useful because of the specificity being 91. And these scores measure the functional respiratory complaints. So things like chest pain. This is the one that specifically looks and diagnosed for hyperventilation. So it's used to quantify and assess normal subjective sensories, and it questions items related to stress, respiration, anxiety, function, and respiratory complaints. All right, so let's get into treatment now. So there's a number of different things that we can do. We'll just start off with breath work in this top right corner here. So it's been noted that breathwork practice for at least 5 minutes a day can lead to reduced stress, improvements in focus, memory, and learning. So we could utilize box breathing, which has been compared to meditation, which has been found to lead to improved mood and sleep. It also influences neuroplasticity of the brain. Cyclical sighing is the next one, which that is or physiological sighing. It's the same thing, but it's a double inhale through the nose and a long exhale. It's kind of a lot like sheep breathing, but it's been found to be actually really effective in improving overall mood, decreasing stress, increasing learning, and also decreasing the resting heart rate. Okay, so lastly now, there's cyclical hyperventilation. So this is similar to Wim Hof. It's not exactly quite the same. Wim Hof is a little bit different, but cyclical hyperventilation is 25 active inhales and exhales. This pours out adrenaline and epinephrine. With Wim Hof, there's going to be various breath holds with the lungs being full, the lungs being empty. There's potential for cold exposures and just a mindfulness component to practice. There is interesting data that's out there that speculates that Wim Hof method could increase production of DMT. Kind of explains why some people have some trips out there. But basically, anybody that does practice cyclic hyperventilation, they are pretty much self-inducing them into a high stress scenario. So they're doing this deliberately, triggering adrenaline and epinephrine. Okay, so optimal breathing in this bottom left corner. There's like 35 different exercises through that course. So I just recommend you guys go ahead and just take a peek whenever you guys have some free time. I only picked out 5 of them: the diaphragm strengthener, a strapping technique, squeeze and breathe, twist and stretch, and a breathing wave. These bottom 3 I think we're pretty familiar with already, so I won't spend a whole lot of time going over them because I'm still trying to be pretty mindful of time. But diaphragm strengthener, I'll talk about in the next slide here, and strapping technique, I'm going to spend a little bit more time on. And as some of us are already pretty familiar with, that PERT could also be a very, very beneficial treatment paradigm to utilize. We're using the diaphragmatic release or reset and the first and second rib release. Okay, so this image shows you the diaphragmatic strengthener. This could be used to better control the diaphragm because it's a strengthener. It's going to actually apply resistance, requiring more force to breathe in and out. This is going to create tension in the rib cage. You could also use a strap to help release some of the tension, but pretty much an exercise that we could do with this is blow in into it and blow out to lift the ball to the top. We could also try changing directions with breath without dropping the ball to make it waffle up top as a tube. And the idea is just to be able to maintain for as long as we can. So if we could do something as long as like 5 seconds in each direction, I mean, that's pretty much what the exercise kind of looks like. But the goal is to have stronger inhales, exhales, and we want to breathe easier, deeper, feel more free when we breathe, an overall sense of calmness, more natural, smooth breathing patterns. Okay, going on to the next one. So this one is the optimal strapping technique. So there's 3 positions that we're going to measure at. First position being above the rib, second position kind of being above the nipple line, above the breast tissue, The second position is more mid-sternum, and that third position is going to be around the xiphoid process. And what this creates is a triangle of stability. And it's important just to kind of note that it should be like this, where it should have a bigger base uh, than at the top. Because if it was reversed, then that person would probably be more likely to sustain or display more like high breathing patterns or upper chest breathing patterns. So there's a couple different techniques we could use this for. We could use a strap onto the upper chest to then go through the same treatment protocol. It can go through the sternum. It could even be treated lower towards the belly button. And there's even a side-to-side component that goes along with this as well, which, I mean, post tests are looking to assess for, is it easier to breathe? Is it, um, do you feel more free? Do you feel less restricted? Come with a sense of calm. And also some of these kind of help out actually with organ massage, so to speak. All right, so optimal squeeze. Pretty sure you guys have seen this before. It's a three-dimensional breathing paradigm where it could be done standing with your thumbs in the soft spot between your ribs and your pelvis. And as you actively squeeze while you inhale, you allow the belly to expand and the back expand. And once you reach the top of your breath, you release your hands and you exhale for a slow 8 count, reaching to that bottom 3, and then repeat that 3 times. So benefits to it, I mean, obviously are just kind of the same, where we're looking for a deeper sense of calm, less anxiety. And it's also just a great beginner one for people that have never really done breath work before, just to kind of get them introduced. Optimal reflex triggering twist and stretch. I'm pretty sure a lot of us are familiar with this one, so I don't have to spend a whole lot of time onto it. But the process, I mean, it's right here in the image where we're sitting in a chair, we exhale to the bottom of the optimal breathing window, we extend and twist to deepen that exhale, and then we come back to center, inhale, exhale, then repeat to the other side, and we repeat that for 10 times. This is the breathing wave. I've used this on a pole vault athlete, and I've actually had some pretty good results. So we're still seated. They're taking that natural breath, checking in beforehand, exhaling to the bottom of the window, forward bend to deepen that exhale. And then as they rise, they inhale to the top of that breathing window and exhale again, and repeating that about 10 to 20 times. And we're looking for improvements in breathing, that they could feel that they could breathe deeper with less effort. There also may be an increased energy sensation. That'd also be another good sign of of the treatment actually working. Okay, so this is the primal reflex release technique, the diaphragm reset. I personally haven't gotten a lot of great results with it. I don't know, maybe I'm doing it wrong, but yeah, anyways, I don't feel like I need to spend too much time on this, because I'm sure that we've all taken this course before, so I'm just going to keep going on. The first and second rib release. I haven't really used this before for breathing, but I've used it for other things, shoulder sprains and SE sprains and things like that. And I've had some pretty good results with it. So yeah, I mean, I'm pretty sure you guys are already aware of how to perform this one by simultaneously tapping on the brachioradialis and also on the subclavius, and repeating as needed while the patient's eyes are closed, lateral flexion to the non-affected side. All right, so let's wrap this up. So some take homes for you guys. Really, what I hope you guys got out of this the most was just understanding how the ANS and breathing mechanics really correlate at a much deeper level, from the subconscious and conscious pathways, how breathing patterns can be altered, what healthy and unhealthy breathing patterns look like. And hopefully you guys walked away with enough to understand assessments and outcomes that we're looking for, like the optimal breathing window, energy sensation, rib cage measurement, high-low assessment, breath rates and pauses, pain and movement. And like I said, there's treatments that we could utilize. There's SFMA breakouts that I'm aware of that have been pretty useful. I'm not savvy enough with SFMA, so I didn't really have a whole lot to discuss on it. There's PERT treatments. Once again, I haven't been super successful with it. And then there's all of the breathing exercises through the Optimal Breathing Academy. And it also really highlights the need for breath work in clinical practice, for those patients that would probably benefit from it. All right, and that brings us to the end. So if there's any questions, please feel free to let me know. And here are my references. Well, thank you all for paying attention, and I appreciate you guys, and I'll see you guys in class. Take care.